Hi guys, so in this video we'll be talking about the muscles of the upper arm and a couple of conditions associated with this. So we only have to know a few muscles of the upper arm, for example biceps, brachialis and triceps. So these are the main three muscles of the upper arm. So as you can see, this lavender muscle here is the biceps, the middle one is the brachialis and the posterior one is the triceps. So there will be a connecting muscle between the brachialis muscle here and the radialis muscle, which will come in the arm here. So this brachial and this radial will be connected through this brachioradialis muscle. Alright. So again, the anterior muscle here is the biceps, the posterior muscle here is the triceps, and the middle muscle is the brachialis muscle. Alright, and the one connecting the brachialis muscle and the radialis muscle would be brachioradialis muscle. Alright, so the next one is the arm. Okay, so whenever you look at your arm anteriorly, alright, so just look at your arm right away. Put your arm forward in front of your eyes and take a look. So all the muscles you will be seeing anteriorly now are the flexors. Alright, and the muscles on the extensor side, on the posterior side are the extensor muscles. So again, you can just think of it as AF, right? Like it was good AF, it was bad AF, I'm hungry AF, etc. So A for anterior and F for flexor. So all the the whole anterior side of the arm will have flexor muscles, and the posterior side will have extensor muscles. All right. So the anterior side is also called palmar side, because that will eventually lead to your palm, and this is the dorsal side. This is the ventral side as well. All right, and this would be your dorsal side. Okay. So now let's talk about the disorders of associated. So the first thing and the main thing we have to know is biceps rupture. So first of all, what is a tendon? Okay, so a tendon is part of a muscle. So just imagine this to be your muscle, all right, and this is the bone. Just say this is the bone. Okay, so there should be something that is connecting the muscle with the bone, right? So this here, that connection here is called the tendon. Okay, so this tendon is gonna connect the muscle with your bone. All right, so this is the muscle, for example, say brachial muscle. This bone here, say, is the humerus. This here is, say, the radial bone. So both these bones are connected to the muscle via the tendons. So as you can see in this image, this white color structure here, that is connecting this bone and the muscle, and then this bone, right? So that white color structure is nothing but the tendon. Okay, so when that ruptures, that is easy to rupture. Okay, it is easy to get ruptured because it is sort of weak. All right, so when this structure, when the biceps has a proximal tendon here, because this is more proximal to our body, and this tendon here is the distal tendon, right? So when, as you can see here, this tendon is nothing but a support. Okay, it's a supportive structure. So like, for example, here this tendon here, this muscle here, it is properly balanced, right? It is in proper shape because of this proper support by this tendon. But then, as if you can see this one here, there is no support here from one side. From the other side, it is still supported, but from this side, it is not supported well. Therefore, this is gonna pull itself back. It is gonna pull itself back more distally, all right, like this. So it was supposed to be just a normal muscle like this, but because of the loss of support here, it is gonna be going like this. So as you can see in this guy, there is this Popeye sign. This is called the Popeye sign. Okay, so if you've seen the cartoon called Popeye the Sailor, you would know Popeye in this also had this kind of weird bicep look. So that is nothing but the Popeye sign. Okay, so this is the proximal biceps rupture leading to Popeye sign. So you can remember P, proximal, Popeye, PO. Okay, and distal biceps. So now this time this is broken, right? So since this is broken, now there is no communication between this tendon and the muscle. So now the muscle is gonna pull away from this tendon, and now it is gonna go like this, right? It is this side, it is gonna go like that. So you can see it here. It was actually supposed to be straight here, but in this patient there was a probable distal biceps rupture, because of which it has pulled itself upwards like this. Alright, so that is nothing but the biceps rupture. Now let's talk about golfer's elbow and tennis elbow. So as you can see in this video here, this guy is playing golf, and if you notice, more pressure is being put on the medial side of his body. Therefore, his medial epicondyle is the main thing that is being used in this game, right? Because there is more effect being put on the medial side. Here this woman is playing tennis, and if you can see, this is where the lateral side of the body is where more pressure is being put on, right here. So that is the lateral epicondyle. Therefore, in this patient, the lateral epicondyle will be more affected. So golfer's elbow, the medial epicondyle will be affected, and so whenever there is a problem with the medial epicondyle, which comes here, it's not being seen in this image, but the medial epicondyle will come on the other side, and this is the lateral epicondyle, right? So from the medial epicondyle, the nerves, the muscles come forward, okay, come anteriorly, and from the lateral side they go posteriorly. Therefore, the anterior muscles, that is from the medial epicondyle, flexors are being arised, all right, and from the lateral epicondyle, extensors pass. Okay, so whenever there is a problem with the medial epicondyle, the patient's flexors are going to be affected. So in this patient, because this patient has problem in the medial epicondyle, the patient will have problem with the flexors as well. So the patient will have pain and tenderness when there is at the medial epicondyle, and this will cause pain when the patient is flexing her wrist. So the management for this condition is activity modification. That is the main thing. So if the patient is a golfer, let's just ask him to pause playing golf for some time. NSAIDs for pain, steroids, local steroid injection for the inflammation release, physiotherapy to make the patient have better movements, and surgical release of the flexors if nothing else is working. All right. And in tennis elbow, like we've discussed, her lateral epicondyle is going to be affected. So late tennis, okay, just you can remember it as late tennis, lateral for late tennis, right? Late TE, all right. So lateral, just pronounce it as late tennis, and because of this E and all, you can just remember the extensors. So this patient, whoever is playing tennis, he's going to have extreme pain in his lateral epicondyle, which is going to lead to pain when the patient is trying to extend his wrist or his fingers. All right. So the pain and tenderness at lateral epicondyle, positive Cosen's test. That is nothing but when the patient is extending his wrist, he's going to have pain. So the management in this condition is the same. Activity modification. So ask him to play tennis less frequently. NSAIDs for the pain, local steroids, physiotherapy, and surgical release if nothing else works. You can also remember lateral tennis and lateral epicondyle with this. It's a nice picturization. So this is a tennis bat, and here you can just put a L here, so it becomes lateral and tennis. So again, tennis, lateral, late tennis, because of the E, it is extensors. All right. And GM, right? So you can remember good morning, GM. So G for golf, M for medial epicondyle. All right. So this patient, whoever is playing tennis, is going to have inflamed or injured lateral epicondyle, and golfers will have pain in the medial epicondyle. So yeah, that's it. Thank you.